Okay, I'll be putting a series of videos now on Viva VOC examination from upper lip. And first I'll consider osteology, and the first bone that we are going to cover in this video is clavicle. Now these videos, they will provide you quick revision of bones of upper limb just before practical examination, and all the important questions and along with the answers you will find in this video. Okay, so now when you pick up clavicle during Viva Voce examination, the first question often asked is which type of bone is clavicle? So the answer is it is a modified long bone. Now why we say that it is a long bone? Because this is involved in weight transmission. All long bones are involved in weight transmission. Why we call it modified? But modified because it does not have a medullary cavity. Next question asked is what are the peculiarities of the clavicle? So you must remember there are how many characteristic feature or peculiarities of clavicle? In total you have 7 points to mention. So what are these 7 points? Let us look at them. The first is that this is the only long bone that is placed horizontally in the body. So this is the only long bone which is placed horizontally. All others are placed vertically in the body. Then second one is that it has no medullary cavity. I have already mentioned that. Then third is this is the first bone to begin ossifications, right? And this begins around ossification around 5th to 6th week of intrauterine life. So 5th to 6th week of intrauterine life, and is the last to complete ossification. When does it complete ossification? That is around 25th year of life. So this is the third point. Then the fourth point is it has how many centers of ossification? It has 2 primary centers of ossification. Usually, in fact, all other long bones, they have just 1 primary center of ossification. Then we have fifth point, it is subcutaneous throughout. So you can feel it from its medial end to lateral end throughout. You can feel this bone, so it is subcutaneous throughout. Then sixth is it may be pierced by supraclavicular nerve. With supraclavicular nerve, especially it is the middle supraclavicular nerve. And the last point is most of this bone has intramembranous ossifications. You must be knowing all long bones, they have endochondral ossification, but clavicle, except for its medial end, has intramembranous ossification. So these are the 7 peculiarities of clavicle that you must know. Now, how will you determine the side of the clavicle? Once this has been asked, then you are asked, determine the side of the clavicle. So how will you determine? First of all, you must know basic parts of the clavicle, and they are, it has got 2 ends, medial and it has got lateral end, right? Remember all long bones, they have 2 ends and a shaft. Similarly, clavicle also, that also has 2 ends, and these are the medial end. This is the medial end, and this here is the lateral end. And in between, what do we have? In between here, this whole thing is the shaft. This whole thing is the shaft. So in case of long bones, you have upper end and lower end, and in the middle you have shaft because those are vertically placed. So in case of clavicle, you have medial, lateral end, and you have the shaft there. Now next is how will you identify which is the medial end and which is the lateral end? So that can be identified because the medial end here is expanded and it is quadrilateral in shape, whereas the lateral end you can see is flattened from above downwards. So this way you can place the quadrilateral end on the medial side and the flattened from above downwards, that end on the lateral side. Next, let us see what about the shaft. The shaft here is curved, and you will find that the medial 2/3 of the shaft, that is convex anteriorly. So medial 2/3 of the shaft is convex anteriorly, and obviously it will be concave posteriorly. So now you know which part has to be directed anteriorly. the clavicle with that part, right, that is where the medial 2/3 is convex anteriorly, that should be facing, you'll put in front. Next is superior and inferior surface. Now how will you find that? Superior surface is smooth. You can see here the superior surface is smooth, whereas if you look at the inferior surface, there is a groove, right? In this groove which you see here, this is known as subclavian groove. So because of these, you will be able to determine the side of the clavicle, and this clavicle belongs to left side. Now, as I said, the superior surface of the shaft of the clavicle is smooth, but the inferior surface has got grooves and certain rough parts which are present on the inferior surface. So let us look at those general features. Now we will start with the medial side. If you see medially, there is a roughened part here on the medial side, and this impression here, this will be a ligament will be attached there, right? So we will look at that ligament also, that is costoclavicular ligament will be attached there. And then in the middle we find that there is this groove, and this groove is known as subclavian groove, right? We'll see that a muscle is attached and a fascia to the margins of this. We will just look at that. Then the third thing, now come to the lateral side. So you have a rough impression on the medial side, you have a groove in the middle of the shaft, and on the lateral side of the clavicle, on the inferior surface, what you find? You find a bony prominence that is a tubercle. This tubercle is known as conoid tubercle. And from the conoid tubercle, if you see here, going anteriorly and laterally, you have a ridge. And this ridge is known as trapezoid ridge. This also is going to provide attachment to these two, right? The conoid tubercle and trapezoid line will provide attachment to a ligament known as coracoclavicular ligament, right? So let us now see the surfaces and borders of clavicle. As I said earlier, the clavicle shaft is curved, and the medial 2/3 of the clavicle is cylindrical in shape, whereas the lateral 1/3 of the clavicle, that is flattened from above downwards, right? So there will be different border surfaces in these two parts. Let us first consider the medial 2/3. So medial 2/3 is round or cylindrical, so there will be no obvious borders in this part, and there are only four surfaces. So the four surfaces are superior surface, inferior surface, anterior surface, which is convex, you can see here, and the posterior surface, which is concave. Whereas when we come to the lateral 1/3, as I said, it is flattened from above downwards. That means the surfaces will be superior surface and inferior surface. And we have two borders, the anterior border and the posterior border. Now next question which is asked is, which is the most common site of fracture of clavicle, right? So that is obvious, where there is maximum curvature, that will become a weak side. So here the junction of medial 2/3 and lateral 1/3 of the clavicle, this is the most common site of fracture of clavicle, which can be seen in this X-ray also. You can see here, this is the site which is most commonly fractured in case of clavicle. Next question that can be asked is, what are the joints formed by the clavicle? So as you know, clavicle has got two ends, so it can form two joints, right? One at the medial end, another at the lateral end. So let us see which are these joints. On the medial end we have sternoclavicular joint, right? Because it is obvious, medially it articulates with the sternum. And which part of the sternum? This is manubrium sterni. It articulates with that. And which type of joint is formed? This is saddle variety of synovial joint. At the lateral end of the clavicle is going to articulate with the acromion process here of the scapula. This is scapula bone, this is the acromion process, and the joint formed is known as acromioclavicular joint. And which type of joint is this? This is plain synovial joint. So what are the joints formed by the clavicle? Medial end articulates with manubrium sterni to form the sternoclavicular joint, variety is saddle type. Lateral end articulates with acromion process to form acromioclavicular joint, which is plain type of synovial joint. Next is you can be asked to mark the attachments of muscles and ligaments on the clavicle, and you'll be provided chalks, right? So either they can say which muscles are attached to the clavicle, show us their attachment, right? Or you can be asked a specific question, show us the attachment of the muscle on its superior surface or on its anterior surface, or name the muscles that are attached to the lateral 1/3 of the clavicle. So this way they can ask questions, but you should know all the muscles that are attached and the ligaments attached on the clavicle. So in total there are 6 muscles which are attached, and 4 you can view from the superior aspect. One will be present in the groove on the inferior surface, and one is present on the posterior surface at the medial end of the clavicle. Both the ligaments, there are 2 ligaments, we have already seen that, they will be attached on the inferior surface, right? So keep this in mind. Let us start with the superior view and from the medial part of the clavicle. So first muscle is sternocleidomastoid. This is the superior surface. So from there the muscle that is attached here is sternocleidomastoid. Now you don't have to mug up these muscles. You can feel your own clavicle. It is subcutaneous in fact. And at the medial end, just above the clavicle, you reach neck. And this muscle you can feel when you turn your neck towards the opposite side. This muscle is the sternocleidomastoid, clavicular head of sternocleidomastoid. That takes origin from superior surface. Another muscle which takes origin from this anterior surface of the medial 2/3, almost whole of this muscle again you can feel when you go just below the clavicle, right? You find there is chest wall, and which muscle is there? That is pectoralis major, right? So you can see here from the anterior surface, right, of the medial 2/3, almost whole of this, which muscle will be taking origin? Pectoralis major. Now let us come to the lateral 1/3. So lateral 1/3 first is, okay, so this is pectoralis major, that can be seen here. Okay, so this is pectoralis major. Next is lateral 1/3, anterior border now. Right, so muscles will be attached to anterior and posterior border, and again it is very simple. If you look at the lateral end, if you go below, right, you can feel, or anteriorly you feel here deltoid muscle, right? So anterior border of lateral 1/3 will provide origin to the deltoid muscle, which you can see here, and the posterior border, right, that is going to provide insertion to trapezius. This is simple to understand. If you have to feel your trapezius, you have to put your hand on the back, and if you have to feel the deltoid, then you have to put your hand in front. So anterior border will provide of the lateral 1/3 will provide origin to deltoid muscle, and posterior border of lateral 1/3 will provide insertion to trapezius muscle. Looking at the inferior surface of the clavicle, 2 muscles and 2 ligaments will be attached. Superior surface, 4 muscles. Inferior surface, 2 muscles, 2 ligaments. So first muscle we will look at the posterior surface near the medial end, and this muscle is sternohyoid. This is simple to understand. Medially you have the sternum bone. So from the sternum and from the clavicle, this muscle will go to the hyoid bone, sternohyoid muscle. There is another muscle which is attached to a groove on the inferior surface of shaft of clavicle, and this muscle is the subclavius muscle. So this muscle is subclavius muscle. Now there is a fascia which is attached along, fascia which is attached along the margins of this subclavian groove, along this, and this fascia is known as clavipectoral fascia. This is clavipectoral fascia. So this encloses this muscle as well as another muscle, that is pectoralis minor. Okay. Now let us look at the ligaments. So there are 2 ligaments that will be attached. Near the medial end you have costoclavicular ligament. It is simple to understand here because this ligament will be going from the first rib and first costal cartilage till the clavicle. So this is costoclavicular ligament, CC. Both the ligaments are CC, costoclavicular. On the lateral end, we have another ligament, CC, coracoclavicular ligament. So, because laterally you will have on the posterior aspect, the scapula, right? So, going from the clavicle to the coracoid process of the scapula. You can see here, this is the coracoid process of the scapula. This ligament is coracoclavicular ligament. Now it has got two parts. We have already seen the rough parts on the inferior surface, conoid tubercle and trapezoid line. So conoid part is attached to conoid tubercle and the trapezoid part is attached to the trapezoid ridge or trapezoid line, which you can see here. This is the conoid part and this is the trapezoid part. This ligament is going from inferior surface of clavicle to the coracoid process. So these are the attachments on clavicle. Now next is which structures are related to the posterior surface of the clavicle. So which are those structures? Let us see here. In this picture you can see this is the brachial plexus. So we have here the roots are there, the trunks are there and the divisions are there. So divisions and formation of cords that will be passing behind the clavicle. You can also see some vessels here, right? So these vessels are the subclavian artery and the subclavian vein. So they will be also related to the posterior surface of the clavicle there, medial 2/3. Then we can see here another set of vessels coming from head and neck, and these are the internal jugular vein that can be seen here, right? This is the internal jugular vein, this is the subclavian vein, and here you can see they will be forming a vein just behind the medial end of the clavicle, right? And that vein will be the brachiocephalic vein, right? So these structures will come in relation. Let us see here. These will be divisions of brachial plexus will be related. Second is the third part of the subclavian artery, right? Third part of the subclavian artery that will come in relation. And then we have the terminal parts of the subclavian vein, terminal part of internal jugular vein. These two veins will join together to form brachiocephalic vein just behind the medial end of the clavicle. Now you can be also asked about ossification of clavicle because it is different from other long bones. And so there are two primary centers of ossification which appear in the shaft of the clavicle during 5th to 6th week of intrauterine life. Remember, this is the first bone to begin ossification. And there is only one secondary center of ossification, that is for the medial end. And this part is going to ossify in cartilage. Rest of the bone has got membranous ossification. This secondary center of ossification appears between 15 to 20 years of age and fuses with the rest of the bone by 25 years. So this is the last bone to complete ossification. This is important that you should remember. Okay, coming to clinical anatomy, one we have already discussed. You should know the site of fracture of clavicle, that is at the junction of medial 2/3 and lateral 1/3. Another thing that can be asked is, do you have any idea about what is cleidocranial dysostosis or dysplasia? So you should know the answer. Cleidocranial dysplasia or dysostosis, this is a defect which affects mostly the bones which are derived from intramembranous ossification. So there is a defect in the intramembranous ossification. So the bones which develop within the by intramembranous ossification, these are the bones of the cranium and the clavicles, right? So there will be, you will find that it is characterized by delayed closure of cranial sutures, right? So because those cranial bones, they develop within the intramembranous, so the ossification is not proper and there will be wide sutures would be there. So delayed closure of the cranial sutures because the bones have not developed completely at the right time. Then hypoplastic or aplastic clavicles. The clavicle could be very small or they could be absent also. The two shoulders, they can touch each other, right? And there will be multiple dental abnormalities also. So this completes the video on clavicle.